Well, we're on the subject of health and medicine today, and most of this chapter focuses on U.S., which is something that you really need to learn about because, as you know, I'm sure from personal experience or that of others that you're in your family or friends, the healthcare system in America is a mess and an expensive mess, unconscionably expensive and unnecessarily expensive. And we'll go through that a bit here. I really hope you'll take the time to watch the film Sicko. You will understand so much more about the whole situation than I can ever explain. I wish we could watch it in class together. It's so powerful. I know you may not, it's long. You may not be able to see it all this week. Please, at some point in the near future, watch it. I couldn't put the whole film up because, for a variety of streaming reasons, but it's readily available, if you have Netflix or Amazon or a variety of other things. So, all right. So let's first of all talk about the definition of health. According to your text, health is the state of physical, mental, and social well-being. A different sociology textbook that I love's definition is this. Now listen to this, because they added something, excuse me. The state of physical, psychological, social, and spiritual well-being, that there's 4 components to it. So right off the bat, as we're talking through this, I want you to think about those 4 areas of health: physical, psychological, social, spiritual. And think about a doctor that you've been to. Were any of those other than the physical addressed? Sometimes the psychological is a little bit. Sometimes there's some questions about that. I mean, unless that's what you're there for, then of course that's going to be addressed. But in general, we have this mind-body split, and, so those other areas aren't even considered or talked about. So we're first going to address global health issues, and then the rest of the text is really digging deeply, the rest of the chapter, into the U.S. healthcare system. So global health issues. Health varies, as I'm sure you know, across societies, but everybody on Earth, unfortunately, experiences the one aspect of health or lack of health, and that's disease. And so the people who study disease are called epidemiologists. And social epidemiology examines how societal factors affect the distribution of disease within a population, not just the infecting virus or bacteria, but social factors, okay? So that's social epidemiology. For example, people live much longer in some countries and regions than in others. They're called blue zones. Well, why is that? As you might imagine, there's been an enormous amount of work done on that. And there are both biological factors that contribute to longevity and very important social factors as well. COVID is another one. We know the biology of the virus, right? The epidemiology of the virus. And we also now know, because it's brought to our attention so in such horrible ways, the social factors that affect COVID. They're huge, as I'm sure you know. So epidemiologists look at 2 factors. These are all epidemiologists, just regular epidemiologists and social epidemiologists. The first is incidence. It's referred to as incidence. And that's just the raw number of new cases of a health problem that occur in a given population during a given time. So just the number, the frequency, the incidence, okay? Here's their example of diabetes. In 2012, 1.8 million new diabetic cases among Americans, was diagnosed among Americans 20 and older. Okay, that's an epidemiological fact. Okay, 1 year, a certain number. The second thing they look at is prevalence. So first we have incidence, the number in a given population at a given time. Incidence is the total number of cases, the extent of an illness or health problem within a particular time. So in 2012, it was, we know the number, 1.8 million. But what was the prevalence? It was 20% of the population over 20 had diabetes, which is pretty shocking in and of itself. So that percentage of a population tells you that the total number in a way that you can wrap your head around differently than, 20% tells you something differently than 1.8 million, as you can see. Okay. And if you look at global health disparities, then there's the classification of countries into 4 broad economic categories, because the economy is a social factor, correct? And so I went online and did some research to update this from the text, and it's worse than, as you might imagine, than the text shows. So if you look at the per capita income of countries rated in those 4 categories that the World Health Organization does, from low income to high income, you can see the figures in your book, but now the low income countries, the average per capita annual income is $1,000 in American dollars, $1,036. We're talking about a year annual per capita income. Low to middle is 1,036 to 4,045. Upper middle, 4,046 to 12,535. And high income, 12,535. This is per capita, per person, adult person, and that's of July 2020. So you can see how that has gotten worse over the years. Okay, and there is a figure in your book with the location of the countries in these 4 categories, their life expectancy, infant mortality rates, and health costs. So, and those variables that I just mentioned, okay, life expectancy, infant mortality, and health costs are what are used most commonly to measure a person or, a country's health status, because it indicates those 3 categories. Let me repeat them again: life expectancy, infant mortality, and health costs. What those 3 indicate are living standards, socioeconomic status, the quality of financial resources that a country devotes to healthcare, which in turn affects the prevention, treatment, and management of illness. So 75 high-income countries make up only 13% of the world's population. That's amazing to think about in and of itself. But of course, that 13%, and we are, of course, included in that, have the greatest access to clean water, sanitation, food, and health services. So the things we die from in that the 13% of the population that lives in the high-income countries, as opposed to the rest of the world, okay, are very, very different. So in those poorer countries, it's chronic malnutrition is the most common killer of children under 5 in lower income countries. And the deaths of children from malnutrition increased from 37% in 1990 to 53% today, which is higher, more children than in your text, which was a 2014 edition. That's increased. Child deaths from child malnutrition have increased around the world, not decreased in the last 7 years. More than a third of the world's population lacks basic sanitation. almost half is at a risk from dying from malaria. 44% can't afford to treat infectious diseases. Okay. So it's true that high-income populations live longer, have a lower infant mortality, and spend more on health care. But what we have in high-income countries, and especially in the US, because we have the highest rates of all of these things of all the high-income countries, are heart disease, diabetes, and various cancers. So when you compare the US with 16 other high-income countries, the United States has the largest growing health disadvantage, in quotes, is what how your book has it. Think about that terminology, health disadvantage. We have the highest health disadvantage of the richest countries in the world. We rank last or near last on 9 key health issue areas: drug-related deaths, chronic lung and heart disease, obesity, the prevalence of HIV and AIDS. Now, that's only 4. They're just listing 4 examples on the list of 9. So, health issues in the United States. Why do we have such a big health disadvantage compared to other wealthy industrialized nations? Well, compared to those other nations, what we have is what are called non-medical social determinants. And we have huge health disparities in the United States. And, COVID has certainly taught us that. We're going to go through some categories now of various aspects, dig a little bit deeper into it. So the first thing we're going to look at here is disability. A disability is any physical or mental impairment that limits a person's ability to perform a basic life activity, walking, doing errands alone, bathing, dressing, working, feeding oneself. Okay. So we're in America now, by the way, looking at health disadvantages in different categories. The first one is disability. This is such an amazing statistic. Almost 30% of Americans over 18 have a disability. That's almost a third of the population over 18. Age is a major factor, of course, with disabilities. So the majority of those are people over, 59% are over age 65. And people aged 18 to 64 are only 26%. Of course, disabilities also increase with age over 65. Women are more likely, not a huge amount more, but more than men to have disabilities, 33% of women as opposed to 25% of men. And of course, people living in poverty, 38%, have disabilities as opposed to people not living in poverty, only 22%. And the number of Americans with disabilities rose from 61 million in 1997. This is another unbelievable statistic. The population in America, the number of people with disabilities rose from 61 million in 1997 to almost 7.4 million in that's wrong. 6.1 million, to almost 7.4 million in 2012. Why? First is behavior that was previously considered normal has been medicalized. So we have more, we have defined people with disabilities as due to behavior. Second, medical advances have helped people live longer with a disability, with disease, so they get they get added as counted instead of dying to the population that's coming along with disabilities. And third, the population of 65 and older is increasing, and then so do disabilities. So let's look at the social determinants of health and illness. Now, listen to that word determinant. It's a determinism, right? These factors that we're going to look at here can determine whether you're sick or well, whether you're healthy or not, those types of things. There are things that you can change, but there are things, if you're in abject poverty or have other issues relative to that you cannot change. So let's think about this whole thing. So the first is social determinants of health and illness. No single variant explains well-being. Genes are something that affect us, yes, and have certain determinants, not social ones, but biological determinants. But just as much as genes, demographic factors, lifestyle factors affect us equally as genes, believe it or not. They have a huge impact on us. So the first is environmental factors. These are just some examples. For instance, there's a very strong association between early life exposure to air pollution and such things as, and these are sort of behavioral issues, autism, schizophrenia, and learning disabilities. Now think about this. Remember when I said some you can change and some you can't? If you're very poor, and the poor tend to live in more polluted and toxic areas than the non-poor, it's very hard to move, right? And yet your children are being affected by air pollution in a lot of areas. Asthma is another one, but autism, schizophrenia, and learning disabilities, okay? What about toxic chemicals in food and everyday products? And I'm not exaggerating. This is right out of your book, okay? So toxic chemicals in food and everyday products like dishwashing detergents. Did you ever think about that? Shampoos, makeup, talcum. Remember the talcum powder? So many women for several generations dusted talcum powder all over their babies. Well, it causes, ovarian cancer, it turns out. So that's linked to and also asthma, some types of cancer, children's behavioral disorders, all from those toxic things that are in products that one uses. Don't use air fresheners, especially in cars, especially if you have babies or children and it's a closed environment. What about noroviruses? They're very, very contagious, and they're the leading cause of death from contaminated food. Well, you might say, well, that's a biological factor. Well, let's dig a little bit deeper here. About 21 million Americans get sick from noroviruses every year. 71,000 of them are hospitalized. 800 of them die. You know what it's due to? The vast majority of them? 70% are due to food workers who are infected and don't wash their hands. Now, who are the food workers in the United States for the most part? They're not rich people. They're not people with great access to health care. They may not speak English. They may not understand that you need to wash your hands frequently if you're working with food. This is pre-COVID, by the way. So that has to do with social factors, even though it's a norovirus. So access to health care can prolong your life, but about 30 million Americans don't have it today. 440,000 die each year from preventable medical errors. Did you know that's the third leading cause of death in the United States? And what that involves is prescribing the wrong drugs, drug interactions, misdiagnosing by docs, and that injures 1.3 million per year and 7,000 die. And another growing problem with America, I know this is depressing and I'm sorry, but knowledge is power. So just remember that this knowledge enables you to have more choices than you may think you have. You may think twice about purchasing a particular food item in a particular kind of packaging, or, as I just mentioned, air fresheners and that type of thing. So, another growing problem is antibiotic resistance, and that kills an estimated 35,000 people annually. I looked that up to get a more up-to-date figure, and your 2014 book said it kills 23,000 annually. Now it kills 35,000. So that's a huge difference. And there have been no new antibiotics discovered since 1987. Not because there aren't any new ones that could be discovered, but because Big Pharma is not interested in doing it, because they're much more interested in higher profits. And so what they research is very expensive and very specialized medicines. We don't have a lot of time to get into this deeply, but the overuse of antibiotics is not just in medicine, but in, once again, the food you eat. Commercially raised cattle, poultry, all of that have lots of antibiotics in them. And of course, they are overprescribed. They're prescribed for things they don't address. And Americans have come to, in some way, demand them, and be very upset if they're not offered antibiotics, if they're not feeling well. So there's a lot of factors involved in that antibiotic issue, aside from the Big Pharma not investigating newer forms of antibiotics. So what about demographic factors? Well, believe it or not, religion, family size, marital status, whether you live in an urban or a rural area, and other variables affect your health greatly as well. Now, age, that's kind of a no-brainer, right? And of course, it is the single biggest predictor of illness or disease is age, and death as well. So, death rates drop shortly, just as a statistic of a general population, drop at least in industrialized nations. I need to qualify that. They drop shortly after birth, and they begin to rise about age 45, and then greatly escalate after age 78. That's death rates. So another age category that unfortunately has a higher death rate, it's, in that particular demographic, are adolescents. Many of those problems that create, well, not just death, but ill health, health issues, are related to, choices people make, but you have to remember the kind of stress also that people are under. So many adolescent health issues or deaths have to do with drugs, smoking, alcohol, texting while driving. And then you get a break between adolescence and kind of your late 30s, where things start to emerge that have been dormant for a while, possibly like genetic issues, once again, lifestyle choices, and then just natural aging after 30. After 65, the kinds of ill health that people have are more chronic. They're not acute diseases necessarily. Now with COVID, of course, that happens. But one of the reasons that the elderly are more affected by COVID is because of their chronic, already pre-existing conditions. So things like asthma, high blood pressure that develop over, a lifetime and gradually. In contrast, acute diseases, things like chickenpox, for example, can strike very suddenly and spread very rapidly. But it can, as you know, cause incapacitation or even death, some of those acute diseases. So chronic diseases people kind of live with and go on and on and on, and they take meds for them and modify their lifestyle and that type of thing. But those increase as people age. Things like dementia and Alzheimer are mentioned as examples in the text. So that was age as category, demographic category of social factors. Sex is another, the next one we're going to look at. There is a gender gap in life expectancy, as you know. It's been narrowing as women both started working, smoking, and drinking more. But we still live longer than men. Still, I believe, about a 7-year average longer. Men of two racial and ethnic groups are 2 to 3 times more likely to die in, I don't know why I have racial, ethnic, but men, I don't think that's racial and ethnic groups. It should just be men are 2 to 3 times more likely to die in motor vehicle crashes, to be victims of homicide, to smoke, drink alcohol, abuse drugs, and also working in dangerous drugs. Dangerous jobs. Men tend to work and think about logging and, linemen, and even construction could be dangerous, of course, being up high and on roofs and that type of thing. So, in terms of gender, depression is the single most prevalent mental health problem among adolescents. It begins about age 14, and it affects about 30%, a third, which is so sad, of U.S. high school students. I'm sure it's higher now during the epidemic. So girls are more likely than boys to present with symptoms of depression, but the reasons are similar. And the reasons are things such as substance abuse, bullying. And this is interesting, either being bullied or being the bullier, okay, being the perpetrator. Both can lead to depression. Understandably, it's not a nice feeling to be either one of those things, the perpetrator or to be bullied. Sexual and physical abuse is another major reason. Parental divorce and a family history of mental disorders. Now, as adults, across all ages, women are more likely to be taking antidepressants than males. And we know that depression can lead to suicide. And I'm sure you're somewhat familiar with this statistics. It's an interesting one. Women are twice as likely to attempt suicide, but men are 4 times more likely to die. There's a lot of reasons for that. It's felt one way. One element of that is that with women, it's more of a cry for help than really a complete death wish. But the other is the way that women commit suicide generally, or attempt to, than men. Men tend to use things that really will do you in quickly, like a gun. But women tend to do drugs or a variety of other things, or sometimes cutting in ways that doesn't completely cut enough to bleed to death, etc. Now, it gives you time to be found, in a sense. And so those are the 2 reasons that women that men commit suicide, actually not just attempt, but succeed at suicide at much higher rates than women. So that was it, gender. Now let's look at social class. Social class has probably the strongest, if not one of the most strongest effects on our health. Because as early as age 45, the lower the family income, the greater the likelihood that adults will have 2 or more chronic diseases. There are so many reasons for that, but certainly stress is huge. Poor neighborhoods are very stressful to live in. There's also such issues as diet, smoking habits, alcohol use, sedentary lifestyles, Often the neighborhoods people live in, very poor people, there's no recreational facilities of any kind, and you really don't necessarily want to be outside walking around that much in many of them. The poorer you are, the less access you have to health care. Also, the more likely you are to have dangerous jobs. So that's pretty powerful. I don't remember if I mentioned it in this class or not, but I'm going to tell you a study that was done about, and if I did, then it's just a repeat, a study about black men that was done. You know, black men have the highest rates of heart disease in the United States. And so a group of social scientists and medical doctors got together to do a research on why that is. And this would never have been discovered had it not been that it was an interdisciplinary group and there were psychologists, sociologists, and anthropologists involved as well as MDs. You know what it turns out? Why black men have the highest rates of heart disease? It does have to do with all those things we just mentioned: poverty, diet, et cetera, et cetera. But the biggest one is the stress of I shouldn't say just, the stress of being a black man in a racist society and having to watch your back every second that you're not in your own family situation. Extremely stressful. So that's another example of how social class and those types of things can affect, and race and ethnicity, which we'll get to as well. Next. So now we're on race and ethnicity. And one of the things that they start this with is that one of the main ways that demographers and medical researchers look at the health of a population is they look at the infant mortality rate, which is the number of babies who die within 1 year of being born per 1,000. So the number of babies under 1 year old per 1,000 births in a year. Okay, one for every 1,000. So African Americans are more than twice that of whites, and to have a very high infant mortality rate, and that's due to a combination of factors. More of them are born prematurely. Many African American women are so poor that they don't get any prenatal health care, and so they don't show up at a hospital often until they're in labor, and so any problems that could have been addressed earlier have not been. So more are born prematurely is another reason. They have less access to health care, as I just said, and a greater risk of maternal high blood pressure, diabetes, and obesity. Interestingly, Latinos have the highest life expectancy rate despite lower education. The only reason that that's brought up is because the higher education you have in strata, the longer, more longevity and better health people generally have. So it's an anomaly, is why they mention that. So Latinos have the highest life expectancy rate despite lower education, lower household incomes. Life expectancy is the same. The higher the household income, the longer the longevity generally. So it's called a Hispanic health paradox, and there's been a lot of research done on this too, as you might imagine, about why that might be, and it's thought it's due to several reasons. First of all, Hispanic groups have a greater likelihood of being undercounted in every area, and so because of people who have not migrated through the immigration system, so that can lead to false results. Another theory or idea, and there's some research to support that, is that those who migrate tend to be healthier than those who stay at home, which makes sense because it's a project to migrate. And also, interestingly, compared to other racial and ethnic groups, they tend to engage less in unhealthy behavior, such as drug abuse, prescription drug abuse, etc. But here's the other aspect of this. The longer Latinos and Hispanics live in America, the worse their rates of heart disease, high blood pressure, and some types of cancer and diabetes are. And that's due to acculturation to U.S. culture, which is, there are unhealthy lifestyle changes that occur through acculturation, such as smoking, excessive alcohol consumption, less physical activity, unhealthier diets. So, looking now at lifestyle factors, because we've looked at age, gender, race, and ethnicity. Now we're going to look at lifestyle factors. Those choices, these are the things where you folks really have the power to a great extent. Once again, you can't necessarily change the neighborhood you live in, et cetera, et cetera. And those neighborhoods often don't have grocery stores. They're food deserts, as the terminology is called. So, but within certain parameters, there are some major choices that can be made. And those choices can really improve or impair your health. So the top 3 lifestyle preventable health hazards in order of priority are smoking, obesity, and substance abuse. No matter where you live, those can all be addressed, right? The obesity is a little difficult, though, in food deserts. Once again, if you live in a place where there's no fresh fruits or vegetables to purchase or healthy food, then that is more difficult. But certainly smoking and substance abuse are ones that can be addressed no matter where you live, although we go back to stress again and self-medication, so there's that issue. And sexually transmitted diseases are the other diseases that can be greatly mitigated by positive lifestyle choices. So now let's address healthcare in the U.S. and globally. This is where the film Sicko will really enlighten you, as you will look at the U.S. healthcare system compared to, let me think what they do. They do Canada, Great Britain, and France. So you'll look at healthcare in 3 other industrialized nations. Oh, in Cuba, they go to Cuba at the end. So healthcare in the U.S. and global is in 2013, 13% of Americans had no insurance. And that was down because the Affordable Health Care Act was passed during the first Obama administration. By the way, the name of that act is not Obamacare. Obamacare was a term that Republicans coined to demonize the Affordable Health Care Act. And then, unfortunately, everybody started picking it up, which drives me crazy. There are some very funny things on the internet. If you just Google ACA versus Obamacare interviews, something of that nature, you'll see people interviewing people on the street, like in New York City, saying, "What do you think about Obamacare?" "Oh, I hate it." Blah, blah, blah. "Why do you hate it?" he asked one woman, and she's, "Because I hate Obama." Then he asked the same people, "What do you think of the Affordable Health Care Act?" "Oh, I love it. It's wonderful. Now I can have insurance and all of that." Well, in one instance, in one of these interviews, the interviewer tells the person that they're the same thing, and they won't believe him. So, remember, what we call things often changes the way we think about them. So it's better now. In 2013, the percentage of Americans with no insurance is down from the ACA, which was passed in 2010, the first Obama term. So the people that are least likely to be insured are Latinos aged 19 to 34 with household incomes of less than $50,000. Who pays for health care in the United States? Approximately now, 66% of Americans, so that's 2/3 approximately, have health coverage through private insurance, which is employer-based in the United States. In no other industrialized nation is health insurance employer-based. And of course, that access to employer-based insurance has deteriorated over the years. Some have stopped offering it completely. Some are considering stopping. There are sometimes the penalties that they have to pay for not offering not offering health insurance to employees are less than it costs the company to give the employees health insurance. Most part-time workers aren't covered in America because it's employer-based, right? And then Medicare covers those who are 65 and older. So when you compare the U.S. with other nations, we spend more on healthcare than any other country. More than the 10 highest spending on healthcare countries combined. Okay. By 2022, healthcare expenses will consider one of every $5 in the United States, which means it's 20%, right, of our gross domestic product, our medical expenses. Why are we so much worse off than other high-income countries? Please watch Sicko, you'll understand why. This is one aspect of it. About a third of the amount of money, 20% of our gross domestic product, about a third of that to almost half of medical spending in America is either wasteful or inefficient. Canada, Germany, Great Britain, France, Japan, Sweden, and all the other Scandinavian countries, I might add. In those countries, the government pays most of the healthcare expenses. There is no profit, there's no billing to insurance providers, and there's a huge administrative saving right there. And another aspect of this huge amount that we spend versus what other people spend is that in those countries, the government keeps drug prices low, prescription drug prices, and the cost of services down. They have a limit on what you can charge. Many people in America now are getting prescription drugs from Canada because they're so cheap compared to here. That's why they have a universal government-funded healthcare system. And they won't let prescription companies rip people off. They just won't do it. So that's a difference. In the U.S., this is a quote out of your book, hospitals are the most expensive part of the world's most expensive healthcare system. Even supposedly nonprofit hospitals have ways to make some profit. Also, and if you've gotten a bill from a hospital lately, you, I'm sure, are aware or have family who has the outrageousness of the cost of hospitals. The U.S. has the highest prescription drug costs. We just talked about that. We spend more per capita on medicine than any other developed nation. And also our reliance on all the bells and whistles and machines, i.e. medical technology, also increases the cost dramatically in America. So what do the different sociological theories think about this whole subject? Well, what functionalism says, as you might expect, is that good health and medicine benefit society. Well, that's true. No one can deny that good health and good medicine benefits society. And how the functionalists look at this is that healthcare is an institution, and it is integrally related to other institutions in society, like government, in terms of so government funds research, scientific medical research, etc. It also regulates certain aspects of the medical system. Healthcare is also closely aligned, as we just talked about, with the institution of the economy in the United States, and it is the nation's biggest employer, for example. There's also a concept in functionalism called the sick role. This is really interesting, and we've all been through this if we've ever called in sick to school or to work. the sick role, a definition is a social role that excuses people from normal obligations to illness. And it has certain rules, if you will, that go with it. So the first is that it has to be temporary, right? The second aspect of it is that you have to be seeking help for it. You need to get medical help to hasten your recovery. And if you don't do those things, if it isn't temporary and you aren't actively working to get better, you can be perceived as a malingerer and someone who's just calling in sick. We have that terminology, right? So it's really only legitimate if it's short-lived, but it's dysfunctional if you use being sick in order to get out of doing something that's a responsibility that you're supposed to be doing, going to work, going to school, etc. Now, here's another aspect of this, and that is the physician gatekeepers, it's called. If you think about this, it's doctors who play a key role in limiting the sick role. And and saying, no, it's time for you to go back to work now, or, that type of thing, or, questioning people about whether they're really still sick, or, that type of thing. That's a gatekeeping function. So what the conflict theorists say, as I'm sure you're not surprised by, is that our medical system benefits some more than others. And I think we've just proved that. When you see sicko, you'll really see that. And that there's also an element of social control in the institutions in America of medicine and healthcare. So docs, for instance, have, as your book points out, almost absolute power in diagnosing, providing treatment, deciding on medical procedures, etc. Think about the terminology non-compliant. You can be labeled non-compliant if you say to a doctor, I'm not sure I want to take that medicine, or I don't think I want that surgery. I'm going to wait it out and see how it goes. You can be called non-compliant. Now, they can't do anything to you except terminate you as a patient, which they can do. Say, well, if you don't follow my advice, I'm not going to see you anymore. But if it relates to a relative of yours, someone in a coma, particularly a child, and you want to wait and see or not do this particular procedure, they have legal control over those issues and can really, either enforce what they want to do or stop you from doing what you want to do, etc., in terms of your own health care. And also, I'm sure you've had this experience in a doctor's office where, you can't get a word in edgewise. I think it's less than a minute that in a patient-doctor interaction that the doctor allows a patient to speak, and then they're pontificating from then on. And so, I can't tell you how many times I've had to pull those if I'm in a new situation where I've had to pull out the fact that I'm a professor and I know what I'm talking about and I know how to do research. Then you get a little bit of respect, but not necessarily a lot. So this absolute power the doctors have in this diagnosing, providing treatment, deciding on medical procedures is one aspect of social control of medicine and healthcare from a conflict perspective. Another concept is what's called the medical industrial complex, just like the prison industrial complex. It's a business, right? The more we privatized prisons, the more that's happened. Actually, the more we privatize medicine instead of having a universal healthcare system, as other countries do. Then you get a network of business enterprises that influence medicine and healthcare. And one of the biggest examples of that is what's called Big Pharma, the big pharmaceutical companies. So listen to this. The percentage of Americans taking 5 or more drugs increased from 4%, which sounds about right to me, then only about 4% of the population would ever need to take 5 or more drugs, increased from 4% in 1994 to 20% today. Okay, I looked that up to bring it up today. Your text in 2014 said that it says 2014 text, it says in 2010 it was 10% of Americans who were taking 5 or more drugs a day. I just looked it up and it's now 20%. That means it went up 10% in 10 years, from 10% to 20% of people taking 5 or more drugs a day. Think about what that involves. Think about drug interactions. Think about the number of people who don't take their prescriptions properly, et cetera, et cetera. And of course, prices of drugs have just gone through the roof and escalated. Prices of drugs for blood pressure to multiple sclerosis have doubled since 2007. So the next aspect of this from a conflict perspective is health, profit, and waste. So we know healthcare is a big business, right? We know there's very high salaries and very high prices for everything medical. And so that's one of the major dysfunctions from a conflict perspective. The feminist theories address the aspect that it seems to be, and this is true based on research, that health and medicine benefit men more than they do women. There are higher health costs for being a woman. So first of all, before the Affordable Health Care Act, insurers charged women more, particularly women during their childbearing years. They charged them much higher rates than they did men. And as I said, the Affordable Health Care Act made that they couldn't do that anymore. But women do generally have greater needs and greater costs with health care. So, and then, I don't know if you know about the big C-section thing in America. We have the highest rates of C-sections of any country in the world. About a third, over a third, about 33% of births are C-sections. They were 5% in 1970, which is about right. Around 5, I mean, at the high end, 10%. 33% is just ripping people off and making a lot of money and ripping, there's the money aspect, there's the psychological and emotional aspect of it and that type of thing. Another one is mammograms. I'm sure you're familiar with this if you're, a bit older, that, it used to be recommended that you get a mammogram a year. Unpleasant, not cheap. Okay, both. Well, after following women who got mammograms every year, once a year, for 5 years, guess what? They were no less likely to die of breast cancer than those who didn't. So now the American Cancer Society and the docs all recommend cutting back on that. But why was it recommended? Well, probably to make money, that type of thing. And then there's the gender stratification of healthcare occupations, which many of you are moving into. The increase of women in med schools has been dramatic over the last decade or so, a couple of decades maybe. But still, the lower level positions, the non-MD positions in healthcare are predominantly held by women. And there's also the area of men's control of women's health, which relates to the political world, men who are not medical professionals, but who feel like they have the right to control women's health in terms of abortion and contraception. And there's the national level of that, but it also varies from state to state, legislatures, depending on access. And so that is the perspective, the feminist perspective. Now, we could go on for hours on any one of these particular theories or issues, but they're important for you to think about and to be aware of. And the last one, of course, is symbolic interactionism. And the subtitle of this section is the social construction of health and illness. Well, we kind of saw the social construction, oddly enough, in the functionalist perspective, in that the sick role is a role, and a social construction and way of thinking about being ill, although it's a functionalist perspective. But so from what they're talking about here is what's a disease? Alcoholism wasn't a disease. Obesity wasn't a disease. It became redefined. I'm not saying that alcoholism is not a disease. I'm just saying that it got redefined as that in more recent years. Okay. There's others too. I mean, menopause, is that a disease? Didn't used to be a medical problem. So this definition is really interesting about how things are labeled and the definitions change. There's also, as they point out, with the social construction of health and illness, that there are differences across cultures and social classes about how disease is thought of, what kind of protocols to use, that type of thing. What the causation of things. Those of you who are reading, sorry, got the wrong class here. I was thinking of another book. But yeah, I mean, there are various, okay, let me just give you the example of the book that I was going to mention, which is the Anthro class is reading. The Spirit Catches You and You Fall Down is what the Hmong, people from the Cambodian mountains who are call epilepsy. Now think about that, the terminology, the social construction, the spirit catches you and you fall down, has a very different context of what's going on with someone who's having an epileptic seizure than does the word terms epileptic seizure. Okay. And then there's the medicalization of health. Since it's a for-profit system, the more things you can say you need to buy to fix, the more profit there is. Adult diapers is the perfect example of that. The meds for, erectile dysfunction, menopause, all of those things, balding, none of those things are pathologies. They're natural processes. But if you label them, and some of the famous ones in the other textbooks are ADD and ADHD. When I was a little girl and little boys got real antsy in class often, or a particular little boy, the teacher would say, Johnny, you need to burn off some steam. Why don't you go out and run around the playground a few times and come back when you can, attend or sit still. It's a very different attitude. I'm not saying that there aren't real problems there. I'm just saying that by labeling it, it allowed for meds to be sold, all kinds of processes to happen, that type of thing. So that's one of the most common ones that's used. And so that's it. And I will see you next week.